I'm Dr. Susan. I'm an orthodontist and a clear aligner specialist. So if you're ever planning on doing clear aligners, do watch this video. It's going to be really useful for you. The first thing that you have to note while you're doing an aligner treatment is if the treatment is done by a specialist. So who's a specialist in doing clear aligners? Of course, it's an orthodontist. And who is an orthodontist? Orthodontist is somebody who spends 3 years after their undergraduate degree learning about how to move the teeth properly and safely. So an orthodontist would be the best person to have your aligners or even your braces done. The second thing is, when you're choosing your aligners, you should choose a well-reputed brand and a really good material. So how would you know which is a well-reputed brand? You can always ask your doctor about the results that they have achieved with the particular brand. So I'm not saying one is better than the other, but choose one which your doctor is really comfortable in, and they have done a lot of cases in that with that brand and with that material, and they have got good results. Then you can choose that. The cheaper ones are not always the best ones. Another thing that you have to keep in mind is when you're doing your aligner treatments, before your treatment itself, ask the doctor to show you the treatment plan, what is planned in your case. Except in some cases where there are already gaps in your teeth, many cases we need gaps in your teeth, and sometimes we need to go for extraction of the teeth. So if you're not comfortable with extraction or any method of space gaining like IPR, IPR means interproximal reduction. That means reducing a little bit of enamel from your teeth in between your teeth to create the space to move your teeth. You need to be comfortable with all these procedures. Make sure that what is planned in the treatment is conveyed to you beforehand itself, and that you're comfortable with it. Another thing that you have to keep in mind is there are small attachments that have to be placed in your teeth for proper movement of your teeth. So even though these attachments are not very visible, they are quite visible. And so make sure that you're okay with that. Ask your doctor to show you pictures of how attachments will be on your teeth. And if you didn't like something, or if you're not comfortable with something, ask your doctor if it can be changed. Sometimes it cannot be changed. You have to accept it. It's different with different labs how the system works. So you have to ask your doctor beforehand itself, doctor, if there is any problem with my treatment, will I get additional aligners free of cost? Limited amount of correction is free of cost in most aligner cases, and it's always advisable that you stick with those. The last thing is retention. You should know what is retention, and you should wear retainers to retain your teeth in that position for a particular amount of time so that your teeth stabilizes in the new position. Otherwise, your teeth always has a tendency to go back to where it was coming from. So these are very few things that you can keep in your mind while doing your aligner treatment. If you would like a part 2 of this, do let me know in the comments. Thank you.